Dear adolescents, dear teenage girls, dear vibrant girls, here are the risks involved in egg donation. So before you become an egg donor to someone, you have to be well enlightened. In the developed society, they actually don't encourage young girls or young adolescents to donate eggs. They prefer mothers who has given birth, who has their own kids, to be egg donor. Juicy gist for you. When I was in the university, there was this young man that was well known in the faculty that approached us. We were ladies seated, and he said, I have juicy business for you ladies. Okay, Oga, give us the gist or the juicy business. He said, you are going to make about 150 to 200,000 or more, or 250 if you can just donate egg for people, women that are looking for egg. We're like, emphasize, what does it entail? He said, all you need to do is just collect little injection. You just go to the hospital, they just give you small injection. When they give you small injection, they just extract your egg, and that's all. He made it look so easy without less stress. But I am here to enlighten the adolescents or teenagers who are in the university, and somebody might bring that juicy kind of business to you. This is where I can counseling outreach, and of course I still remain Rachel, your online counseling. So when a man or a woman brings that juicy business to you as a young adolescent or as a teenager, here are some questions you should ask. What is egg donation? What does it entail? 2, you're going to ask, is egg donation legal? 3, you're going to ask, does it involve life? Is my life at risk? The next question you're going to ask is, who are the principal person involved in this egg donation? The last but not the least question, hope is not going to make me infertile in future. Because in trying to help somebody to conceive, hope at the end of the day, I won't be finding it difficult to conceive. Here are the essential questions. As adolescents, you should ask somebody that is bringing such business, such juicy business to you. But before I answer those questions, let's go briefly on what egg donation is all about. Before I proceed, if you're not following Royal Care Counseling Outreach on all social media platforms, you are wrong. And if you are yet to subscribe to our YouTube channel, please don't forget to join the family by hitting the subscribe button. We are available for counseling outreach programs, especially those of you that want to host any educational program and you need counselors to help you address your audience. Don't forget to book Royal Care Counseling Outreach. You're faced with personal social problem, vocational problem, we are available. Okay, counseling outreach. Let's go back to the main topic, egg donor. So let's define egg donor. Egg donor is a lady or a woman who decides to help another woman to conceive through donating of her egg with the use of vital fertilization, IVF. I've done a video on ectopic pregnancy, uterine fibroid. If you're yet to watch it, please do go and watch it. There are some instances that I'll be mentioning under the reasons for egg donation that are here that you might not understand, that you have to refer back to those videos. Then I'm going to drop a little picture of the video so that you can go watch it out. Now let's talk about the reasons for egg donation. Those receivers, some of those receivers that are always looking for people to donate egg to them, they often believe that they are infertile. That's why they're looking for egg donors. Number one of such reasons why somebody will be looking for egg donor is fallopian tube damage. I talked about fallopian tube damage in ectopic pregnancy. Once your fallopian tube is altered, is damaged, or there's an alteration in there, it is very difficult for you to conceive. Go and watch ectopic pregnancy for you to understand better. 2 reasons why a woman would be opting or looking for egg donor is ovulation disorder. A woman who doesn't ovulate at all, because there are some people that don't ovulate at all because of some health or some medical issues. I'm not going to go too deep into that. Due to some medical issues. Some women don't even ovulate. Why some ovulate but not regularly? Such people, is very difficult for them to get pregnant, especially people that don't ovulate regularly. So they don't even know when to have this intercourse for them to conceive. So when they are having ovulation disorder, they find it difficult to conceive. That's why some of them look for egg donors. The next one is uterine fibroid. I talked about it in my previous video. If you're yet to watch it, go and watch it for you to be well enlightened. The next one is previous tubal sterilization. A situation whereby the tube or the ovaries has been removed or it has been altered. This can occur as a result of ectopic pregnancy. As I said, go and watch ectopic pregnancy of my previous video and uterine fibroid. This can be as a result of ectopic pregnancy. It can be as a result of cancer. It can be as a result of previous abortions. Number 5, which is the genetic disorder. People don't actually believe in this, but it's actually in existence. If there's a medical condition that affects your parents, your mom, your aunties, it can affect you and can make you infertile, which makes you to be running kitty to look for egg donors. Number 6, we have fertility preservation in cases of cancer. A situation whereby a woman is being diagnosed of ovarian cancer, she can ask the medical practitioners to keep her egg so that when she wants to make use of them, she can opt for surrogacy. That's where surrogacy comes in place. I'll talk about that in another video. So she can opt for surrogacy, making her a mother later in future. But some of those patients that actually demand that their egg be frozen, be kept for future use, some of them don't end up surviving. So at the end of the day, they have to sell those eggs to people who are looking for children, to people who want to conceive. So that is one of the reasons for egg donation. Dear adolescents, dear teenage girls, dear vibrant girls, here are the risks involved in egg donation. So before you become an egg donor to someone, you have to be well enlightened. In the developed society, they actually don't encourage young girls or young adolescents to donate eggs. They prefer mothers who has given birth, who has their own kids, to be egg donor. But in our contemporary society, where they want to exploit the young girls who are not well enlightened, who are not well informed, they tend to want to pay cheaper, so they make use of them because they are not well informed. One of the risks involved in donating egg is ovarian hyperstimulation syndrome. There are some medications that are being given to you that want to donate egg. As a woman or as a lady who wants to donate egg, there are some medications that are being given to you. But you know, our hormones varies. There are some people that when they take the medication, it works effectively, no problem, no damage. But some people, their hormones might not carry it, so it becomes hyperstimulation. It's to stimulate your system so that those eggs can be harvested. But instead of just stimulating, it becomes excessive. It becomes hyper-stimulating, which can be detrimental to that woman's health. Number 2, we have increased risk of pelvic disease. That's pelvic inflammatory disease. It can cause, due to the devices used to puncture or used to harvest the eggs during the procedure while trying to puncture, it can cause the pelvic to be infected, which can lead to pelvic inflammatory disease. I talked about some of these in ectopic pregnancy and uterine fibroid. Please go and watch them if you're yet to watch them. Increased risk of puncture of the bladder, blood vessel, and other structural areas in the ovaries during the retrieval of eggs. So while trying to retrieve the egg or while trying to harvest the egg, mistake can occur because we are human, we're not God. The bladder can be punctured and that can lead to fistula. Or blood vessels can be punctured, that can lead to bleeding to death. if not properly managed, or other areas of the ovaries which can affect you from conceiving in the later future. Enough of the egg donors. Now let's talk about the receivers, those planning to receive eggs. Here are some complications you should take note of. Number one, we have multiple pregnancy and birth. Fertilization is usually done outside the womb, and due to that nature, or as a result of that, multiple fertilization can occur. You hear the receiver saying, I just need a child. And at the end of the day, fertilization is occurring in such a way that 4 babies are growing, 3 babies are growing. So what happens to the remaining? Okay, for instance, somebody is looking for just a child, or the person can only afford just 1 child, and 3 to 4 babies are being fertilized. What happens? Number two, we have increased incidence of premature delivery and low birth rates. The weight of the baby might be little or low, and premature babies can be born because fertilization is done outside the womb. Number 3, we have high rates of miscarriage. In some cases, some of those babies implanted might not survive, and to worsen it all the babies might not survive. That's why some egg donors will be like, I've gone for that, I've opted for that option before to try to conceive, but the babies did not survive. That's what happens. Sometimes they don't survive. Sometimes some of them survive and some don't survive. The last but not the least is increased incidence of ectopic pregnancy. I've talked about ectopic pregnancy in my previous video, so watch it out. Now let's go back to those questions I asked. Is egg donation legal? What do you think? Don't forget to put your contribution below. We're going to be using Nigeria as a case study because I am in Nigeria, of course. So we're going to be using Nigeria as a case study. In Nigeria, there's no law that accepts or rejects such. So we can't say it's legal and it's illegal in Nigeria. But where the corner or mago is involved is when you are going for egg donation. In your own mind, you believe 1 egg is going to be harvested. But those medical practitioners don't usually harvest 1 egg. Sometimes they go as far as harvesting 5, 6 eggs. And you as the individual wouldn't know, especially you as an adolescent. In our contemporary society, abortion is considered illegal. It's not legal. So, sometimes in cases of ectopic pregnancy, you have to evacuate that baby because the baby is, of course, harmful to your health. So in cases of that, they believe you have done an abortion. In cases of multiple babies, where you want to have just 1 baby and you are seeing 3 to 4 babies growing, you know, of course, you have to remove those other 3 babies. So will you call it killing of those babies, those other babies that fertilize? Meanwhile, you're looking for just 1. Are you going to call it killing of those babies? In our culture in Nigeria, it is considered a taboo or unethical for you to get rid of those babies. Young, vibrant adolescent, young, vibrant lady, young teenagers, before you go into egg donation, here are the principal persons that ought to be in existence before donating your egg, of course. Number 1, the egg donor, which is you, the receiver, obstetrician, dietitian, your pharmacist, your reproductive health worker, and of course the nurses, your pharmacist. Okay, I've talked about pharmacist, your lab scientist, your own legal practitioner, which is your barrister, and of course your counselor. You ought to be well informed, well equipped about what you are about to go into. Our 3 question is, can death occur during egg donation or after egg donation? So you, the donor, as an adolescent, as a teenage girl, open your ear. It's not something you just do, boom. You have to be well informed. I've been shouting, you have to be well informed. And in most cases, or in developed countries, they don't accept teenage girls to go into it. But In our contemporary society, they offer teenage girls very little amount of money. The receivers must have paid huge amount of money, but it is what it is. They offer them very little amount of money just to take advantage of their ignorance. So, can death occur? Yes, the answer is yes, death can occur. Some complications can occur which can lead to death. Some people might even be allergic to those medications that are being given to stimulate you for them to be able to harvest the egg. Sometimes doing puncturing for egg harvesting, if the bladder is mistakenly punctured, that's harmful to your health, of course. Or if one of your blood vessels is being punctured, bleeding can occur and death can occur. Number 4 question is, can it lead to infertility in the later future? Yes, it can. That's why they always advise mothers to be egg donors, because of course they already have children, so what are they using their eggs for? But because they want to take advantage of the ignorance of teenage girls, they go for them so that they can pay them little. So infertility can occur when the fallopian tube is being altered or the ovaries is being altered. It can lead to fallopian inflammatory disease, which can lead to infertility. My last word to the teenage girls is, before you go for egg donation, make sure your legal practitioner is involved, and make sure your counselor is involved so that you'll be well enlightened. Your legal practitioner is to help you bargain financially and help you with the terms and conditions involved. Imagine you're paying the reproductive health workers 10 million and you are being paid 150,000, and you are the principal person, you are the main person. Just imagine the exploitation that is being done on you. So your legal practitioner must be involved. And I know when you involve your legal practitioner, they might say they don't want. It's better for you because at least you know your life is safe. Anything that happens, if you don't have a legal practitioner, they will deny you hands down. I still remember Yaka Counseling Outreach. Don't forget to hit the subscribe button, and if you find this video very educative to you, please don't forget to give us a like and a juicy comment. Thank you very much. Bye bye.